next speaker is one of the earliest people that I worked with in the union movement. I didn't work in the union movement, she did, but I was a naive junior person at NIOSH at the time, and Peg was working in the union, and it's an honor for me to present Peg Seminario, the Director of Health and Safety for the AFL-CIO here in Washington, D.C. Peg?
Good afternoon. It's wonderful to be here. When I came in and I saw Dick, Dick and I, and many of you, we go way back. And you think about the history that is in the knowledge, but most of all the dedication and commitment that is in this room, and what people have done through their decades-long work in protecting workers and protecting the public from this awful scourge. And I want to thank Linda. I don't have to reiterate and say everything that everyone has said here about Linda, about that she just doesn't stop. She just never stops, and she always pushes forward. And I want to thank you because I think what you have done, I mean, you're the one that's brought this community of people together to focus on these issues, because I think the biggest problem that we face today is what everyone up here has already mentioned, is that there's a general sense in the public and amongst a lot of workers that asbestos is no longer a problem. It's a problem of the past. It's a problem, that came from decades, exposure of decades ago, and so that it's really no longer a major worker problem or an environmental problem. And that's, as we all know, just not the case. So the question is, how do we change that? I think we can look to some of the lessons of history. As Mark and others have said, I mean, this has been a decades-long effort. One of the first things that I worked on when I came to the AFL-CIO 40 years ago was on work on asbestos. It was both at a policy level, but it was also at a local union level where folks working in the Navy, in the shipyards, both up in Portsmouth, New Hampshire, as well as in down in Hampton Roads, were dealing with asbestos, and there was a question here: what level of exposure was safe? And clearly, no level of exposure was safe. And for these workers, what they were trying to do was to get the Navy not only to comply with the existing rules, but to lower exposures. And they were able to do this. They weren't doing it through OSHA, because the OSHA standard at the time was incredibly high, even though we knew it was too high. They were trying to do it through their union contract. And how they were doing it was sort of an imaginative way. They were going after the Navy for hazard pay. And I didn't believe in hazard pay. You don't have, you don't pay people to be exposed to things, but their strategy was that if it cost the Navy enough, they would reduce the exposures. And that's exactly what happened. And so this is here I was a 24-year-old woman, or young girl at the time, going into this arbitration and laying out the facts and laying out the information, and the expert from the Navy coming in. And I just remember this is one of the first things that I worked on when I came to the AFL-CIO, of these folks from the local union. At first they were like, she's our expert, and the bottom line was we blew them away, not only laying out the evidence, but laying out what could be done to control the exposures, and they won. They won millions of dollars in back pay. They got paid. But what happened there, and again, both in Norfolk, up in Portsmouth, New Hampshire, was they cleaned up the asbestos and they changed their practices so that workers weren't exposed. And I think one of the things that we have to think about is, particularly in this new environment that we are in, where we don't have, aren't going to have the agencies, I think, have the commitment or the capacity to deal with these issues. We've had, wonderful people at EPA and at Fed OSHA during the Obama years. You couldn't have people that were more committed to protecting workers. And we had an enhancement in enforcement with bigger penalties, bigger fines. And we also had the government calling out employers, calling out the bad actors, and we had an increase in criminal enforcement. And that applied to asbestos as it did to other things. I was looking at the OSHA website and at EPA and the Justice Department, and major actions against contractors, big and small, major actions against big companies like U.S. Steel. Bottom line is that they were exposing people, they were using workers who weren't certified, weren't trained, using undocumented workers, but aggressive enforcement action that made a difference, at least in those workplaces, and hopefully in other workplaces and other communities by publicizing those actions. We've got an administration now that obviously doesn't support these kinds of programs. They've slated EPA for a 31% cut. Labor Department is scheduled for, they're trying to get a 21% cut. They're trying to eliminate all the worker safety and health training that OSHA does and that OSHA supports. So those are some of the proposals that we are facing. At OSHA, they've decided they're no longer going to put out press releases about enforcement action, so we don't know what is going on. And right now, as far as EPA, I must say, in terms of an agency that is under assault and under attack, I've never seen anything like it, and they are basically become the target of all the anti-regulatory venom and the venom against the government and government workers. And so we have to do what we can to support all the people who work there and are continuing to try to do their jobs. But looking forward, again, what do we do? I think this may be a time, because of the circumstances that we are in, that again, we have to look to do things both in a clearer way, a stronger way, a louder way. And the Asbestos Disease Awareness Organization, when I first met Linda and they were talking about awareness, I was like, oh, education's nice, But I think it is so true that given where we sit with asbestos, that people think, again, it is a problem of the past. It is not something that we face today. Looking at the latest information that came out of CDC, the latest statistics, and if you haven't read the March 3rd, 2017 Morbidity, Mortality Weekly Report on mesothelioma, you should. It is really, it is chilling. 2,600 mesothelioma deaths in the United States that at least were reported in 2015. And that's obviously not the lung cancers, it's not the asbestosis. Many of those from the past exposures, but frightening information is that there's young people that are still dying from mesothelioma and developing disease. And all we heard about today about the continuing exposures that occur. So I think we have to regroup here and make asbestos a problem of the present, not talk about it as a legacy issue, because again, much of the disease is a legacy problem. There's no doubt about that. And it's a legacy that all of us, or many of us in this room, have lived for decades and decades, and it's a legacy that far too many people are still experiencing today. But I think our challenge is, how do we bring asbestos to be a problem of the present and a problem of the future with an immediacy and an import that has to be dealt with. And I don't have the answer as to how we do that, but I do think part of it comes focusing on the exposures that are occurring to workers today, to the public today, that have to be addressed, and bringing those forward and highlighting them, combined with the people that are still suffering, the people that are developing the diseases, not only the older folks that are developing the diseases from 40 years ago, but the younger people who are experiencing the diseases today. So I think we have to really focus our strategy on looking forward and bringing this problem as a crisis of the present and a challenge for the future, and demand that our public officials address it and deal with it and acknowledge it. And so, again, looking forward here, I think that is where we need to be going, and it may be possible. We know that this government at the federal level, they're not going to be dealing with anything new. I mean, maybe we can get them to move on a few things. So maybe it's possible here to, in this space, when there's a total reluctance to deal with anything that's a challenge that hasn't been dealt with, to get a focus on asbestos and more attention and more efforts directed to dealing with the scourge and the continuing exposures that are occurring in our workplaces and communities. Thank you.